Hello, I'm Dr. Josh Wiedermann, a pediatric otolaryngologist. Today's video, we will walk you through an intracapsular tonsillectomy. This technique to a tonsillectomy offers a less painful alternative to the traditional extracapsular tonsillectomy. To begin, the oral cavity is exposed in the standard way with a Crow-Davis mouth gag with the endotracheal tube and the tongue suspended from the Mayo stand. Although several techniques allow for intracapsular dissection, this video shows this technique using a Coblator wand. For the right tonsil, the surgeon's right hand is used to retract the anterior pillar and to position the tonsil ideally for coblation. I use a setting of 7 for ablation and 3 for coagulation, but these settings can be titrated to surgeon preference. Any bleeding can be quickly stopped by switching to the coagulation setting. While activating the ablation setting, quick painting movements are used to ablate the tonsil down to a very thin shell, leaving a small rim of tonsillar tissue to protect the peritonsillar fascial plane as well as the constrictor muscle beneath. This rim protects the constrictor muscle from thermal injury, significantly reducing the risk for pain and bleeding postoperatively. Once the ablation is complete, the entire tonsillar fossa is treated with coagulation energy. Given the excessive irrigation required for this technique, a nasal suction is passed through the nose and sits in the oropharynx to gather irrigation. The intracapsular tonsillectomy is designed for children who suffer from sleep-disordered breathing secondary to adenotonsillar hypertrophy. Although randomized control studies have yet to be performed on a large scale, large retrospective reviews show significant reduced postoperative pain and hemorrhage while still achieving the goal of reducing or eliminating obstructive sleep apnea. The Coblator wand can then be used to perform an adenoidectomy under mirror visualization in the standard fashion. This results in a quick and thorough ablation of the adenoid tissue. Again, any bleeding is stopped with coagulation. Key points of this procedure. Intracapsular tonsillectomy offers an alternative to traditional extracapsular tonsillectomy for sleep-disordered breathing in select pediatric patients. Copious irrigation as well as quick, precise movements allow for efficiency of movement as well as reduce injury to surrounding structures. An intracapsular tonsillectomy often results in decreased postoperative pain and hemorrhage while effectively treating sleep-disordered breathing.